Ladies and gentlemen, this is a brief presentation on cerebellar stroke as part of the Masterclass Medicine series. I'm Dr. Prosper Tettey Doe in the United Kingdom. Cerebellar stroke manifests with ataxia, vertigo, dysarthria, nausea, vomiting, and often a prominent headache. There is rapid deterioration in these patients, which is particularly vexing because of difficulty in mobilizing neurosurgical intervention and the uncertainty regarding the mechanism of deterioration. It is also difficult to determine whether ensuing coma results from potentially reversible causes such as evolving hydrocephalus, brainstem compression by mass effect, or irreversible brainstem infarction. Now, the clinical and imaging features. The clinical and imaging features of patients with cerebellar stroke can be helpful in clinical decision making. There is no single clinical or imaging finding that can be used in isolation when deciding whether to use aggressive surgical management or to withhold such therapy. The overall clinical gestalt of the patient with cerebellar stroke remains paramount, and patients during the first week in hospital need observation in neurologic intensive care units, which will facilitate timely recognition of neurologic deterioration and permit immediate repeated imaging to guide an appropriate and tailored surgical approach. Ventriculostomy may be an adequate temporizing measure in the patients with deterioration predominantly resulting from obstructive hydrocephalus, whereas definitive treatment of progressive brainstem compression most often requires craniectomy for decompression of the posterior fossa. What's the prognosis like in this condition? Patients with declining levels of consciousness, new brain stem signs such as, in particular, loss of corneal reflexes, evolving hydrocephalus, and midline cerebellar stroke are at increased risk for deterioration and poor outcome. Whether prophylactic ventriculostomy or decompression prevents neurologic deterioration is not clear. And this issue should be addressed, the authors said, in a randomized controlled trial. Perhaps diffusion perfusion magnetic resonance imaging could contribute to a better understanding of the importance of infarct volume or ischemic penumbra on the risk of subsequent deterioration and poor outcome. So, ladies and gentlemen, thank you for your attention. This is the reference. Wish you all the best. Bye.